one of my colleagues. All right, thank you so much. All right, so welcome everybody. Today's webinar is a very focused one on a very, very important part of our reproductive system, which is our fallopian tubes. There are two fallopian tubes that every woman has, unless there is a genetic defect at birth. So the fallopian tubes are a very, very delicate part of the reproductive system. And today we're going to look at what does it mean? What are the functions of the fallopian tubes? Do open tubes actually mean that they're fully functional? What can you do in order to make sure that your fallopian tubes don't get damaged? And God forbid, if they're already damaged or blocked, what are your options in terms of treatment? Can you actually fall naturally pregnant? Do you need IVF? All of those questions. And of course, in today's webinar, we've also promised that at the end, we're going to give you the ability to ask questions about your specific case. And of course, we'll keep it brief because we need to be fair to all the other participants, but we will give you specific solutions beyond whatever's there in the webinar itself. So we'll get started. I'm going to request my colleagues to mute everybody else. I think there are one or two people who may still be unmuted. I'm still getting ambient sound from there. So Ginny, if you could please mute. I think there is Dharini who, has probably got her audio on. I know we all have stuff happening at home as well. So let me start my presentation first up. Okay. All right, there we go. Okay, so a quick introduction to Sepalika before we begin so that you understand what it is that we do and why we have the knowledge that we do on fallopian tubes and all other things fertility. We are a fertility and hormone clinic, modern diagnostics and natural solutions. That's our USP. That's what we do. So this particular webinar is on fallopian tubes, right? So just a quick sort of image to tell you what we're going to cover. These are some of the conditions on the left which could actually impact your fallopian tubes. There are many natural solutions that are proposed in popular media, but which of those are truly have evidence to back them and which of those may just be promising too much? What are the actual tests for fallopian tubes? These are some of the key areas that we'll be touching on today. Okay, so Sepalika, in the last 3 years that we've been running a fully online fertility improvement clinic, we've had 30 babies that have been delivered to couples with complicated history of poor IUI, IVF, etc. Several of these came with fallopian tubes that had either hydrosalpinx or one fallopian tube blocked and things like that. Our approach to helping everybody who comes to us is called a 5-petal approach. I'll show you what that means in the next slide. And of course, like I said, you can join us from anywhere across India. We are completely online. That's the team. We've got obviously qualified doctors who work within the natural fertility space. We have allopaths, Ayurvedic doctors, as well as OBGYNs, and that's the entire team. We make sure that we are qualified professionally and that we have the nutrition and lifestyle expertise to make your baby dreams come true. That's who we are. Okay. All right. What is the Sepalika approach? Why do we call it integrative, functional, etc.? Well, basically what happens is in conventional OBGYN or fertility practice, if you think of your health as a 5-story building, all the work is happening on the 5th floor, which is the reproduction. However, we believe that foundational floors number 1 to 4 that you can see on your screen, these are equally crucial. And it is because conventional allopathy and fertility medicine ignores these 4 floors that often you have a problem in the 5th floor. So the Sepalika approach is to work on these 4 floors so that the 5th floor responds by itself. And this is that 5-petal approach that we spoke about. How do we work on those 4 floors? Well, we work primarily with nutrition at the center. Improve your diet, give your body all the raw materials it needs, and it begins to function properly. Wherever it's needed, after blood tests, proper dietary supplements. Ayurveda instead of allopathic medicine, when there is a need for specific Ayurvedic medicines. Lifestyle today, of course, lots of disturbed sleep, high stress can lead to infertility. And finally, the secret sauce is our magnet-based acutherapy. So again, acupuncture has a huge body of evidence for helping with fertility. We do the same thing for you in the comfort of your home using small magnets that are sent to you in a kit, and you are taught how to use them so you don't have to go anywhere or have needles stuck inside you. These are the 5 petals that we use. Okay. All right. Now let's get directly into our topic. What are fallopian tubes? We'll call them FT to save space on the slide. Here are some facts. Fallopian tubes are 10 to 13 centimeters long. That's pretty long, actually. But in its narrowest spot, it's only 1 millimeter wide. 1 millimeter is really, that's like the width of a Maggie noodle, the inside of a Maggie noodle if you hollow it out, right? So that's what the fallopian tubes are. They are the only place where the sperm can fertilize an egg. So inside the woman's body, the sperm and the egg can only meet inside the fallopian tubes during natural conception or IUI. Nearly a third of infertility, especially so-called unexplained infertility, is due to dysfunctional fallopian tubes. This is what the worldwide statistics are. India is the same, if not worse. At least one of the 2 fallopian tubes must function fully for natural conception. This function fully is a very important term, and you'll see why I'm saying it as opposed to open tubes as we go along. The fallopian tubes being open in a diagnostic test, which is called the dye test, or an HSG, hysterosalpingography test, does not mean that they are fully functional. I want to underline this. Open tubes are not necessarily fully functional tubes, and we'll see why. Let's first understand visually what we are talking about. So this is the inside of the pelvic region of every woman. This is the vaginal passage, what we understand from the outside. So let's start with that so that we have some visual reference internally as to where things lie. Through the vaginal passage, you connect to the uterus. This is the cervix, the mouth of the uterus. This is the uterine cavity within which a baby must eventually grow. The uterus is then connected with 2 fallopian tubes on the left side and the right side to your 2 ovaries that are sitting on the left side and the right side respectively. So the fallopian tubes are literally the highway that connects the ovaries to the uterus. And again, you will see why this highway is the most important, most delicate place of the entire reproductive system in a lady. Okay, so what happens in that structure that we just saw? Every month, there is one egg or oocyte that becomes the dominant oocyte or follicle. It grows up to a size of about 22 to 30 millimeters. At the right time, it breaks open from the follicle and an egg goes, kind of forms on the upper surface of the ovary. One very important thing to remember, while it seems like the fallopian tube is stuck onto the ovary in this diagram, really they are very loose and they are simply close to the ovary but not stuck to it. So once an egg is released, this fallopian tube picks up literally that egg, moves it into itself, and the sperms have meanwhile entered after intercourse during the fertile window through this vaginal passage that you can see on the right side of the diagram, the pink area at the bottom, through that into the uterus, and they are now swimming through this particular tube, and we can follow them here in the magnified close-up. The sperms go in, they meet the egg over here inside the fallopian tube. This is where fertilization happens and an embryo is created. For this embryo to become a baby, this particular tube has other functions like nourishing this embryo and then moving it back down into this uterine cavity. And that is what we mean when we say open tubes need to have other functions working as well, and natural conception is possible only inside the fallopian tubes. Okay. So these are the three criteria for fallopian tubes being fully functional. Number one, they should be fully open, which means the tubes have no obstructions inside them. Second, the tubes must be capable and be producing a mucus, a sticky nutritive substance that nourishes the egg, the sperm, and the embryo. This is that second function. The third function is it must have fully functioning minute hair or cilia, which has the job of moving the egg through into the tube, helping the sperm swim into the tube, and finally, once an embryo is formed, to move it slowly down into the uterus. Unfortunately, while we have the hysterosalpingography test to see if the tubes are open, there are no tests available till date in allopathy to check if the tube is actually producing mucus or not, and whether it has hair that are healthy and are moving the egg and the sperm and the embryo properly or not. So even if you have fully open tubes, if the tubes are failing on criteria 2 or 3, you may still not be able to have a natural conception. As we go through the presentation, you will see what can truly help you to have good functions on criteria 2 and 3, even though you cannot really test them. All right. So let's look at criteria 1, for which there are actually tests. So are your tubes fully open? How do you determine that? Well, there are these 4 methods available in conventional allopathy, and I've kind of put them in order of certainty. Which is the one? So starting from the left is the least certain that the tubes are open, going to the right, which is most invasive but highest degree of certainty. So what does this mean? First one is a transvaginal ultrasound. You can see during the TVS whether the tubes are actually looking healthy, but it's a very, very thin structure. So actually, transvaginal ultrasounds are used more for follicular growth, uterine health, etc., rather than tubal health. So this would be the least. You can do hysterosalpingography. This is actually with an X-ray plate. So a dye is inserted through the vaginal passage and it goes and fills up the uterus, this little triangle you can see in the middle. And then it's supposed to fully go through the tubes and spill into the pelvic cavity. And while this is happening, you're lying on a table which has an X-ray underneath. So the doctor or the radiologist is actually taking pictures, X-ray pictures. And in this particular one, you can see the cavity was fully filled with the blue colored dye. It fully went out through the right side of the lady. So the right tube is fully open. However, on the left side, it stops after going up to the mid portion. So this side of the tube is blocked beyond the midsection. A similar test, a newer test, and one that is less painful has been introduced with, again, lesser exposure to X-rays, which are considered harmful these days. So you can do a hysterosalpingosonography as well. However, and in this, sound waves are used instead of X-ray to tell whether or not the tubes are open. The liquid that is used isn't really a contrast dye or a chemical dye. Instead, you use either betadine, which is a thyroid-based solution, or meaning an iodine solution, or you use air bubbles and you're able to see through this whole process, through the water, the saline, or the betadine, whether the tubes are open. The way the imaging happens is with sonography, and this is considered to be a safer and a new, more modern procedure these days. However, it is very, very dependent upon the skill of the person who is doing it. So many doctors still prefer the old-fashioned HSG with a dye and an X-ray rather than the sonography. Finally, sometimes an invasive procedure is needed. A laparoscopic, especially if a lady already has either an endometriotic cyst or she has adhesions inside the uterus, and a laparoscopy is anyway going to be done, which is like making a minor cut around the navel area, and you have a probe that is inserted and a camera that is inserted. Then, of course, the doctor gets to see the actual tubes, whether there is anything sticking to the tubes and pulling it this way or that, etc. So this is still considered the gold standard, but obviously this is a surgical procedure performed under anesthesia, and obviously nobody needs to go that far unless they have other reasons why the laparoscopy is needed. Okay, so the HSG test, like I explained, is basically a contrast medium plus X-ray. Catheter is inserted, liquid is filled, and then you watch for whether both sides, the spillage of the dye is happening or not. In an SSG, which is the sono way of doing it, so the salpingography is done with sound waves. So you've got ultrasound that is used. Again, there is a contrast medium, but it isn't a chemical contrast medium. And you can get, again, clear results on whether the tubes are open or not. Okay. Why do tubes get blocked in the first place? Well, three major reasons that we know. Number one is called salpingitis. Whenever you see the term itis, remember that it merely means pain. That's all. And salpinges is basically the technical term for the tubes. So salpingitis means there is likely an infection inside the tube. These infections in India, in developing countries, can often be due to tuberculosis, which is undetected. Again, people often associate tuberculosis only with the chest area, but there can be tuberculosis of the pelvic area as well, and it can be with absolutely no symptoms. So unlike the chest where you get a cough, you may get no symptoms whatsoever in the pelvic area, but you might still have tuberculosis of the pelvis. And if that happens and that enters the fallopian tube, that might cause this infection and inflammation of the tube. When that gets worse or it gets advanced, either due to, like I said, a tuberculosis infection or any other viral infection. So there are sexually transmitted diseases, chlamydia, toxoplasma, rubella, several other viruses that can invade the pelvic area. It can even happen due to public restroom use, or you wipe in the wrong direction after using the washroom, you manage to pick something up from the toilet seat, or during intercourse. Many reasons why this can happen. And hydrosalpinx is nothing but there is already an infection or an inflammation. There is infected fluid that has now collected within that tube. It appears as a swollen appearance on ultrasound or during HSG. And that's basically what a hydrosalpinx is. It's a swollen tube. Endometriosis is a different condition. Endometriosis is primarily when the inner wall of the uterus, the uterine tissue or the endometrial tissue migrates to areas inside the pelvic area where it shouldn't be. So for example, these brown things are shown as inner wall of uterus having migrated to these various brown areas. And once this happens, the body then tries to repair this by actually producing sticky tissue, these adhesions which are being formed by collagenous bands. The body tries to hold it in place, and this can lead to tubes which get blocked both internally and externally. When it happens externally, it's like binding a rubber band around that tube. So you can imagine, and no egg will be able to come past that rubber band. And that's how endometriosis can block the tubes. Okay, now to the question most likely for which everybody is here. Can blocked tubes be unblocked? Well, at Sepalika, we believe that we must be evidence-driven. So obviously, we are a natural clinic, and therefore we like to produce natural solutions rather than suggest surgery or anything drastic. However, at the same time, we believe that every patient should know what is the level of evidence truly available in published studies for each one of these interventions. Because in today's age of WhatsApp University and social media learning, it cuts both ways. We get a lot of information, but we don't know how reliable that information is. So here's what we have found from the literature, and then we'll go through, what should you be doing in specific cases. Number one, the actual HSG test itself can clear up things which are like mucus blocks. So sometimes, just like you have, let's say, mucus in your nasal passage, and doing jal niti can open that up. Similarly, an HSG test itself, when the fluid is pushed with force through the uterus into the fallopian tubes, it may itself clear partial blocks which are mucus in nature. So this is why, while the HSG test is a diagnostic test, sometimes it can lead to pregnancy afterwards because it's cleared up a partial block. Second, salpingitis or hydrosalpinx. These are infected tubes. And here, antibiotics and herbals may help. But remember, while these may unblock, they dry up the liquid, they take away the infection. But if the infection has damaged that little fine hair, the cilia that we spoke about, or it has damaged the cells that secrete the nutritive mucus, then despite taking this treatment, your tubes may still not be able to help an egg and a sperm to meet and for it to form an embryo that will then move through the tube. Adhesions, when there are full adhesions, either inside the tube itself or outside, like the rubber band. Yes, we have heard anecdotal evidence for castor oil packs. There is much more robust evidence for massages that can actually break open these adhesions and allow for a fallopian tube to open up. But again, the same caveat still holds. If the adhesions have damaged the cilia or they have damaged the mucus secreting cells, then the fallopian tube may still not function despite the adhesions having been broken up. And again, this is important because unilateral blockage versus bilateral blockage, you can see in this diagram where the red arrow is pointing out. Here, the lady only has a right side fallopian tube blockage. The left side is still fully open, whereas in the second one, you can see both on the right side and the left side, there is blockage. So this has implications for what your options are. It's different between unilateral and bilateral. What does it mean? Let's first look at what conventional fertility standard treatment says. When you have bilateral blocks, both sides are blocked, natural fertility, natural conception or IUI is not possible. This is because in both natural conception and IUI, the fallopian tube is the only place where an egg and a sperm can meet. Now, what is your option? You can have surgery to recanalize the fallopian tube. However, this will only work if the blockage is very close to the uterus. Let me use the earlier diagram. Sharda, could you please let me know, can you see my cursor moving?
Yeah, I can hear you. I see
No,
it all. Yeah.
Cursor. All right, great. Okay, so what I mean is recanalization surgery, the way it happens is that the surgeon will insert an iron, a steel, obviously, it's properly made sure that it doesn't have any infections, etc. It's an autoclaved thing that they put in. So you put in a wire through here and it will go into this end of the fallopian tube. So if your blockage is right here within the first 1 or 2 centimeters of the uterine cavity, then you can use the recanalization surgery. The deeper the blockage is, the lesser the chances of the wire being able to open it, both because these tubes are very delicate and you risk damaging the inner hair that lines this tube, right? So that's the reason why recanalization may work, but it only works if it's what's called a proximal blockage. Proximal means near, and near the uterus, you can have recanalization. If the recanalization is not possible, you have to move to IVF. If both tubes are blocked, either in the midsection or the later section, at least conventional gynecology says only IVF is possible. This is because in IVF, they remove the egg from the lady's body, remove the sperm from the gentleman's body, make them meet inside a petri dish instead of a blocked fallopian tube, and put the embryo directly into the uterus. Okay. The only exception to when you should not move to IVF despite having both tubes blocked is in a condition where it's called a bilateral HSG spasm. What this means, again, I'll use this diagram. When the fluid is sent in with pressure, the dye is sent in during an HSG test. If you're very nervous, or if you have read online that this is going to be a painful procedure and you get very tense, then your body will tend to tense up and this area will cause a spasm. So it's a bilateral tensing up or spasm that happens, and this will produce a false result as if both sides are blocked exactly where the uterus joins the fallopian tubes on both sides. So remember, for us to say this person does not have a true blockage, but it's a test-induced blockage, it has to be bilateral and proximal, both sides and really close to the uterus. That's the only exception. Other than that, you need to go for an IVF. Unilateral block, that means one side is blocked, the other side is open. We have had multiple women conceive in this situation. But again, the chances are reduced, but indeed, even with one tube, it is possible to conceive. Partial blocks, many times it will say, the report that you get in HSG will say loculated spill. Loculated is a technical term for tortured or curved up. So it means that while the tube has some liquid that it's allowing to pass through it, it has blockages at multiple points and therefore it's not coming out. If both sides have partial blocks, it's treated the same as a bilateral complete blockage, because those blockages, if even fluid is unable to pass through clearly, then an embryo will certainly not be able to pass. The surgical correction, which is recanalization, has a low success rate. What this means is, even if it is close to the mouth of, to the part where the uterus joins the fallopian tubes, and there is surgery done with a recanalization catheter, 89% of such reopenings close down within 6 months. So all you have is a 6-month window after surgical correction for 89% of the people. Finally, if your report says there are braided tubes, braid means literally like what women do to their hair in India when they say, you're doing a plait. That braided appearance on ultrasound or during an HSG generally means that there is a TB. There is a tuberculosis has affected the tubes. It's either active or it's an old one, but the result is again the same as bilateral. Tuberculosis often damages fallopian tubes beyond repair, and therefore IVF may be the only logical solution for such people. All right. What are some of the popular natural interventions? So I've just picked this, for example, from this site called Top 10 Natural, because I wanted to show you what is it that is there in popular media. No doubt you have come across it. What is our take on it? Finally, we are an evidence-based clinic. So obviously we advise people to do things naturally, but we share with them transparently what is the evidence. The published evidence for many of these particular interventions is low. Anecdotal evidence exists. So it means somebody it worked for, they will immediately put it online saying, hey, this worked for me, why don't you try it as well? So this sort of evidence exists. However, it's not something that we can go by and give you certainty on. Castor oil packs are often cited too. This is the #1 intervention in the natural space. There's no harm in trying it. There is published evidence for an Ayurvedic procedure called Uttarabasti, which in many terms almost resembles an HSG procedure. There is a fluid that is introduced into the uterine cavity. It has a tikshana, or a very strong burning, breaking up strictures quality, and it can open up tubes, but it involves multiple visits to a qualified Ayurvedic physician who will do this often in an operation theater. It is a serious procedure and it must not be done lightly. It must have somebody with a postgraduate degree in this particular OBGYN practice in Ayurveda. Uttarabasti has evidence. Acupuncture, as you will see again, has evidence, but more from China. and it's on Chinese women. Finally, the one that we have only recently discovered because one of our patients brought it to our attention, and this is the irony of modern medicine. If something isn't a medicine-based pharmaceutical or surgical intervention, most people, even in that industry, will not know about it. The same thing was true of us as well. There is a particular massage called clear passage therapies that has been doing this for more than 20, almost 17, 18 years now, but it is only available in the UK and the US. So we'll look at all of these interventions quickly, one at a time. Clear passage therapies is what I'm leading with because this has the maximum amount of evidence. It is a physical manipulation, which means somebody massages you externally on the pelvic region. It is done for for a period of 20 sessions over a week to 10 days. And this is external therapy. And the first study that they published was in 2008. Small sample size, only 24 participants, but it was very scientifically done. HSG was done before the procedure, after the procedure. The intervention was 20 hours of manual physical therapy over 1 week. 17 of the 24 women showed open tubes post the therapy. It's a pretty encouraging result. However, remember, like I said, it's available only in the US and UK. There are other people who claim to do self-fertility massage in other ways, but we do not have published evidence for these. I'm continuing with the second really large study that was published by Clear Passage Therapies. This was published in 2015. The full study, because Clear Passage Therapies does a pelvic massage, not just for blocked tubes, but for endometriosis, for pre-IVF treatment, several of those. The actual N, or how many patients they were able to include in the study, it was 1,392 over a period of 10 years from 2002 to 2011. However, out of these 1,392 patients, those who were treated specifically for blocked fallopian tubes, that number is 235. Out of these 235, 61% or 143 had open tubes in HSG after treatment. Out of these 143, 81 went on to achieve pregnancies. The remaining had other complications beyond the fallopian tube. The one limitation that I must point out, again, because evidence is evidence, is that this is a retrospective study, which means you go back, look at old data and publish it as an analysis. But this is again published in a very high impact alternate therapy health medicine journal. The scientific method followed is quite rigorous. So again, that's a plus point. Remember, clear passage therapies, the success rate after recanalization surgery, it drops from this high 57% to 37%, because when you have recanalization surgery, it not only opens the blocks, but it seems to damage the cilia and the secretory cells as well. Okay, so that's number one, was clear passage therapies massage. Number two, which we are covering because there is evidence for it, but it's not available in India, so it isn't really practical for all of us sitting in this room. It's Chinese medicine. Again, the scale of the study is decent. N is equal to 180. So 180 patients included, 3 groups, allopathy only, allopathy plus traditional Chinese medicine or TCM, and TCM only. Both of the TCM groups outperformed the allopathy recanalization. So there was a success rate of 81% and 78% respectively in the TCM groups, whereas the allopathic group had a 56% success rate. The intervention used was oral herbs plus external, just like the castor oil pack, external application of herbs inside a potli or a poultice. Okay. Ayurvedic Uttarabasti, unfortunately, maybe we didn't search hard enough, but honestly, Ayurvedic, Ayurveda is still a little behind when it comes to publications in the public domain. This is a small study, but again, a beautiful study because they at least followed the scientific method well. N is equal to 16, and this is available in India with good qualified Ayurvedic practitioners who have access to an operation theater because it's not done under anesthesia, but in order to maintain cleanliness and make sure the entire thing is sterile, it is done in an OT situation. They use tubal flushing, so similar to the way in which the HSG is performed using Tikshana or sharp herbals, and it needs OT level expertise. 6 days of treatment in 2 consecutive cycles is what was done in this particular study, and 80% success rate in post-procedure HSG. The tubes were blocked before, they're open later, but it's a smaller study, remember, it's only 16 people. So, that should be borne in mind, but we have access in India. There are qualified Ayurvedic doctors, so don't write this off. This might be a very practical, useful thing for all our Indian patients. Castor oil packs, the reason I am putting it down as the 4th intervention is because there is no published study. I understand fully well, we are ourselves proponents of natural remedies, and there is no commercial interest in a natural remedy. So who's going to publish that study? Yes, we understand that. However, it still does not mean that you should blindly keep using things like castor oil packs. You must try it for a limited period of time. And then if it doesn't work, you have to look at other evidence-based options. This is important because fertility can decline rapidly often. And, it's not, wishful thinking is not an evidence-based way to do it. So there is no published study. However, it is well known especially in naturopathy more than Ayurveda. It's been used for decades now. Naturopathic doctors advise thrice a week. It's supposed to break up blockages because it induces heat. You put a castor oil, you dip the castor oil in these flannel, and then you apply it on top, and then you put heat with a hot bag, and that's how you induce the heat. We will be sharing with you a how-to PDF, how to use castor oil pack at home to try and break up blockages in your fallopian tubes. So that will come to you as part of this webinar. Okay, now, again, I'm bringing this point back because open tubes do not mean fully functional tubes. And this is where you get a secret weapon that you can use. Because even if you have open tubes, unless this particular cell called the secretory cell, whose job it is to produce nutrition and give nutrition to the egg and the sperm, if this doesn't work well, or if these ciliated cells, these little hairs that you can see, if they don't move the egg and the sperm and the embryo in the right direction, then you will not get success despite a tube being open. What's more, even if you have minor blockages, if these two work really well, there is still a chance that you may succeed. And what are the things that actually influence these two cells? That one of them responds most to progesterone and the second one responds most to estrogen. And therefore, estrogen progesterone activity is what, if you can balance it well, it will improve your fallopian tube function too. Okay, so this is basically the 3 big actions that happen. You need strong fimbriae to pick up the egg. You need powerful cilia to move this egg and help this sperm to move. And you need strong tube contractions once an embryo is formed to slowly move this through the tube and into the uterus where the embryo will implant and a pregnancy will begin. So I'm going to request Sharda, because the #1 intervention that can help you balance estrogen and progesterone and support all 3 functions lies within diet. So over to you, Sharda.
Thanks, Mahesh. Good afternoon, good morning still, everybody. So what we're right now focusing on is to say, how do we improve the functioning of the tubes, even when they're open, because we've had a lot of our clients who have been recommended IVF with open tubes. It's not been successful, primarily because the health of the tube is not optimal. So like Mahesh mentioned, he mentioned estrogen and progesterone, which help the function of both the cilia as well as the secretion of the mucus or the nutrition. The other thing is, you must know that in the tube, there is a fluid, and it's this fluid that provides nourishment as well as helps the movement of the embryo, the sperm, and the egg cells. This fluid is made up of vitamins, primarily B, C, and D vitamins. It's made up of proteins. and it's made up of electrolytes, which are micronutrients like sodium, potassium, magnesium, and chloride. So our philosophy at Sepalika, or our approach to diet infertility is, if you remember some of you joined late, but in the early part of the presentation today, we spoke about how we can build the first 4 floors to lay the foundation for the reproductive organs to function optimally. So this is about ensuring that you as the individual, the lady or the couple, are providing the correct nutrition and the correct ingredients or raw materials so that we can allow the fallopian tubes to function at their best. And what the fallopian tubes need to perform are these things. And the impact of this on the diet, Mahesh, if you can go on to the next slide, is what are the 3 big areas that I'd like you to focus on. First, of course, is to balance estrogen and progesterone. Normally, we see estrogen dominance in women, which means there is too much estrogen in relation to progesterone. So perhaps not enough progesterone is being produced. And in terms of diet, the one thing that really works effectively is what is known as seed cycling. I'm sure you're aware of it. For those of you who are not, seed cycling basically involves using seeds in the 28-day cycle of a woman, using flax and pumpkin seeds in the follicular phase or the first 14 days, and sesame and sunflower seeds in the second half or the luteal phase of the cycle. If you don't follow a 28-day cycle, and most of us don't, or even, for example, not even a 30-day, but let's say it's highly irregular, then you start the flax and pumpkin on the day of the new moon. And so you use the moon. So the moon goes through a 28-day cycle. So the first 14 days from new moon to day 14, flax and pumpkin. And then from day 15 to full moon, we use sesame and sunflower. Let me know in the comments box below if you would like a little a guide on this, and we will send this across to you. The second thing the body needs to balance estrogen and progesterone is fiber. Because remember, estrogen, which is often the problem creator, and estrogen dominance that women see, one of the ways that the estrogen exits the body is through your pee and through the bowel movements. So for every woman, and I'm telling you this, the number one thing that you must ensure is your bowels move every day. If they don't move, you can be sure that there is a problem in removing excess estrogen from the body. And the simplest and the easiest way for you to do it is to add vegetables. Forget all the fancy things that you're seeing from dietitians and influencers on Instagram. Just add vegetables, and it is so simple. You don't need exotic vegetables. It is vegetables or sabzis that you have during the season in your home, right? And my guideline to you would be that when you take your lunch plate or your dinner plate, fill half the plate with vegetables. So 50% of your plate is vegetables. And the rest can be, whether it's your rice, whether it's your roti, dal, fish, chicken, can be in the balance 50%. So just ensuring that 50% of your plate. And when I say 50%, it's not just lunch and dinner, it's also at breakfast. So if you're having an omelette or used to having an omelette for breakfast, or if you're used to eating upma or poha for breakfast, ensure that the upma and poha or omelette have 50% veggies and only 50% is egg or rava or poha. That's your way you can get in vegetables easily. So vegetables is one, oats is a great way, millets are good, rice is good, wheat, which is whole wheat. Ideally, I would prefer that you have kapli wheat, is also are great sources of fiber. The third piece to balance estrogen and progesterone, so both estrogen and progesterone depend upon protein for their proper production. So protein, we all know this. Don't think you need to be a non-vegetarian. Dals, peas, chana, rajma are all, paneer, if you can digest dairy, are all great sources of protein. The only thing I would tell you if you're a vegetarian is you need to have multiple sources of protein. The fact is, and I'm not talking about ethics or religion here, the fact is animal protein is far superior to plant protein. But it does not mean as a vegetarian we cannot get it. The way to get it to get full plant protein is to eat it from a multiple sources. So different kinds of dals, please rotate your dals. Chana, rajma, as I said, you can have peas, you can have quinoa, even your millets, your rice and sambar, rice and dal, varan bhat, as we call it in Maharashtra, are all fantastic sources of complete protein, because there are also certain amino acids which are sitting in rice, which are not there in dal, and together they give you a complete protein profile. Okay. And the last one is, remember, both estrogen and progesterone are made from cholesterol. 70% of the cholesterol is made in the body. And cholesterol is nothing but lipids or fats. So please add good fats to your diet. Coconut, cashew nuts, white butter that's made at home, almonds, they're all fantastic sources of, or even cold pressed oils. They're all great sources of fats, again, to help you balance estrogen and progesterone. So that's the first thing, balancing of your hormones. The second thing to maintain the health of the fallopian tubes is to prevent inflammation. So if you remember, we spoke about how the fallopian tubes have to move up and down or contract to allow the embryo to move, the fertilized embryo to move in an implant in the uterus. That contraction happens because of certain chemical compounds in your body called prostaglandins. They're the same prostaglandins which help a woman develop uterine contractions for the final delivery of the baby. Now, the problem with a lot of our diet is that we tend to eat too many inflammatory foods. So prostaglandins can be both good and bad. In modern diet, because we depend on a lot of food sources of which we're not careful, we're not sure. Second, we tend to eat out a lot more or depend on external food compared to what our parents or our grandparents did. We unknowingly eat a lot of inflammatory foods. To counter that, what you need to do is what you're seeing on your screens. Leafy greens, palak, methi, amaranth, bathua. This is the season now coming up for bathua. So winter greens, fantastic. Now, when I ask you to eat leafy greens, I know we all eat greens in our diet. Here, if you want to improve your fallopian tube health, what I have put on the screen must almost become prescriptive, which means at least 3 to 4 times a week, you are including leafy greens in your diet. Ideally, every day. You are including beetroot. So the second category I've put is beetroots. Beetroots are fantastic as an anti-inflammatory function. Broccoli, cabbage, Avla. Avla is great. You can have it in the form of juice. You can add it to your foods. You can make homemade achar with Avla. Pineapple, again, because it contains bromelain. Then is anti-inflammatory garlic, turmeric, ginger, walnuts are very good with anti-inflammatory properties. And finally, omega-3. So most of because we tend to eat a lot of namkeens, outside food, cereals, they contain a form of omega-3 called omega-6. Although we do need omega-6, we eat more, we end up eating too much of omega-6 compared to omega-3, and the balance goes too much in favor of omega-6, which is inflammatory. So to bring the omega-6 down and we need to increase intake of omega-3. The best sources are fish and egg yolk. So please include these in your diet. The last thing I'd like to do is to avoid certain foods which can inflame. If you remember from the beginning, Mahesh has said, as important as a tube being open is the tube functional. So to prevent that inflammation in the body, please throw away any refined oil that you're having at home. They are inflammatory in nature. They disturb the production of estrogen and progesterone in the body. So switch to either ghee or to cold pressed oils. Please have namkeens, but make them at home. Or if you know somebody who makes them with good quality oil. What we don't know is that all stored namkeens are usually, nobody's going to throw away the oil. Once it's fried, they will use and reuse it. Reused or reheated oil is carcinogenic in nature. So it causes inflammation. Switch to homemade namkeens. You can have gluten, assuming you're not gluten intolerant. I'm sure you know this, or if you're working with a dietitian or nutritionist, they will guide you. Avoid gluten, except why? Because gluten can be inflammatory in nature. Avoid wheat, except if you have kapli wheat, because kapli, the structure of the proteins in kapli is not inflammatory. It does not cause that inflammatory reaction in the body. Kapli is basically the ancient variety of wheat that we used to have in India until the late 1960s and early 70s, when we started hybridizing our wheat. Okay. The third category is avoid sugar and maida. I know it is very hard. I know it especially because the upcoming festival season, but when we want to take our fallopian tube health seriously, this is something that's easily avoidable, and there are enough and more substitutes. I will share them with you when I send you the plan. And if you're someone who loves coffee, if you do occasionally smoke cigarettes or you're exposed to secondhand cigarette smoke, And if you do like the drink, at least during the time when you're trying to conceive, stay off all of these.
All right. Thanks so much for that, Sharda. And like Sharda said, there is a diet, an understanding of these principles that will be sent to you at the end of this webinar as part of, one of the offerings that we are sending you. All right. Okay. So I just wanted to, I think last two slides before we conclude, what's most important here is many women avoid an HSG test because they have read online or their friends have told them that they went through extreme pain. Two things. Number one, yes, it can cause pain. And the reason the pain is happening is not because that chemical is harmful or that dye is harmful. It's causing pain because the uterus is a large organ, but this particular width of the fallopian tube is 1 millimeter, right? So when you try to push fluid with force from a large cavity into a small cavity, there is an actual physical pressure that happens. And many women go in already feeling nervous, and that causes a further narrowing of this already narrow tube. And that is the reason you feel the pain. Now, this is where we always advise that you should tell your doctor that you want painkillers. This is one of the few times when we advise the prophylactic or preventive use of painkillers before the test itself. So use of muscle relaxant, use of painkillers can make sure that you do not get any pain, and this is minimal. You just feel a sensation of the fluid going through. This is very much possible. This is especially true if you are overweight, and overweight is being used as a medical term here. If your BMI is above 28, then there is a good chance that during the HSG procedure, you will feel discomfort. There is a lot of fat in that area, and it gives an additional pressure, and therefore proper use of painkiller is a must. In India, many times doctors unfortunately give the option to the lady. They say, here, take this if you feel pain. But once you start feeling the pain, there's no going back from it. So using muscle relaxants like meftalspaz preventatively and taking a painkiller compulsorily rather than electively is a good way to ensure that you get a proper HSG test, one in which there is no false positive because of spasming of the tubes that may happen during the procedure itself. Some doctors prefer to give antibiotics afterwards, and this is again a bit of an elective call, but please go ahead. Don't avoid medications or don't not do the test because you're afraid of the pain. That is just meaningless because the fallopian tubes are very, very delicate. And if you don't have them open, there's no point in trying naturally. Okay. So that's where we are at. That's the entire presentation as of now. So we're going to take questions at this stage. So I'm going to ask everybody, of course, yes, first question is about the recording. Yes, there is recording, and we will be providing you with the recording. Yes, seed cycling, anybody who wants can write in. Anybody who wants to raise their hand and ask a question, we will answer. So go ahead. I can see Pragya, your hand is up. Please go ahead, Pragya. Unmute yourself and ask your question.
Hello. My laparoscopy report says that my tubes are elongated and distal and mild convolution with patent. I don't understand the meaning, what it
Okay,
is.
all right. So what your
Yeah.
report seems to be saying is that imagine you saw in the diagram, the tube was kind of shown as a curve, right? A nice curve. So
Yes.
sometimes the tubes can be looped or contorted, right? So which means something has happened inside that pelvic cavity that doesn't let them be in that shape. So from what you just read out, distal means far away from the uterus, closer to the ovary. Distance and distal, that's what it's saying. So it says there is some convolution at the distal end. However, the tube seems to be fully open because it is patent. Patent means the tube is fully open. So it does seem like your tubes are functioning fine, at least as far as a HSG report is saying. So if that's the entire report, then from a simple layperson or patient's perspective, it means your tubes are working fine for you to conceive.
Okay. But still, I went for IVF and it was failed.
Okay, so IVF failing has nothing to do with the tubes. right? So a tube being open can only help you to either conceive naturally or through IUI. In an IVF procedure, what they're doing is they're removing the egg from the ovary, taking the sperm and injecting the sperm into the oocyte, creating an embryo and putting it back into the uterus. When an IVF round fails, it's more likely due to either the quality of the egg itself, which is an ovarian factor and not a fallopian tube factor. And therefore, improving the quality of the eggs is what needs to be focused on. So this particular webinar being on fallopian tubes, we do have another webinar which is purely about improving the quality of eggs, especially after an IVF that has failed. You can look that up and that will give you lots of tips on how to improve egg quality.
Okay.
All
Thank
right.
you.
You're welcome. Veda, you can unmute yourself. May I request Pragya to mute yourself? Thank you.
Hi, sure. I had a question like I recently gone through this SAT test. So that time I got my tubes are open only. I didn't have any issues on that. But after 1 month, I mean that month I got period early. 20 days only I got a period. So next month I got a pregnant. But so when I got a pregnant on September, that too for twins, one was aborted naturally, one was an ectopic. It was in tube, left side tube. So I went through. I mean, in September I'm going through that medical the treatment. Now it's resolving. So I don't know why. SSC test was successful and open tubes were there, but still ectopic had happened. And now I don't know what is next. And I don't know future how it will be. See, after HHC also I got ectopic.
Got it. Got it.
So what is next?
Right. Okay. So yeah, this is one of the reasons why I wanted to focus so much of our webinar on the two other functions of a fallopian tube, right? Being open means liquid is able to go from the uterus through the tube out onto the ovary. It does not guarantee that the inner functions of the tube, which is to provide nutrition to the baby, number one, and number two, for the cilia to work, that these two are functioning. In most cases of ectopic pregnancies, this may often happen because the cilia or the hair is not able to move a fertilized embryo into the uterus. Okay, so what happens is, like I said, 1 millimeter is the diameter of that tube. Okay, now an embryo is really, really small, even smaller than 1 millimeter. Up to 3 days, the size of the embryo is so small that it can pass through a 1 millimeter tube. But it will need to go through and come into the uterus with the function of those hairs. The little hair on the inner wall of the tube has to brush the embryo to come into the uterus. If that hair is damaged, it may not show up on an HSG test. The test only shows the water is going through. It doesn't show if the hair is functioning. After a first ectopic, then certainly the risk for a second ectopic is much higher. So unfortunately, going forwards, it may be such that for your own safety and for not having another abortion or a miscarriage, use of IVF and bypassing that fallopian tube may be the best idea for you.
Okay. So, is there any? I mean, if I follow some exercises, some yogas, if I follow diet, is not possible to conceive naturally, or is the only solution that I fear?
Yeah, it is possible, Veda. And this is why we like to keep it transparent. By following the diet that Sharda will send out to all webinar participants, you can balance estrogen and progesterone. And like I said, those little hairs which are there on the inner wall of the uterus, they respond to estrogen. When estrogen is properly balanced, it will brush the embryo properly into the uterus. However, it's difficult to tell the degree of damage. What I mean is, let's say hair is there, but it's not moving properly. Then once you use diet, yoga, etc., the hair may begin to move properly. If the hair, however, has been damaged for any reason, then there is no hair to function properly only. So it's a chance that you need to take. And it's an informed choice that you will make. Anyway, using diet, yoga, etc. is crucially important even for IVF success. So please go ahead and incorporate the natural ones, castor oil packs, using the correct diet, using the correct supplements. All of this can support you. However, there is no guarantee that any of this can lead to a non-ectopic proper pregnancy. So you can try for sure, but it's not necessary that it will work. That's the balanced, unfortunate truth.
Okay.
But Veda, what we can do is to not, beyond just sending you the diet and castor oil packs, we'll also send you some yoga asanas that can strengthen and focus specifically on the pelvic area rather than general yoga asanas. So if you have time on your side, you can certainly try all of these in combination. So please ensure you do them religiously, in a disciplined way and consistently, and before you have to take that final call for an IVF.
Yeah, sure,
Okay.
sure.
All
Thank
right.
you.
You're welcome. Rensha, I saw your hand go up next. If you could please.
Hi. I had a question about the ectopic pregnancy. We started trying in March this year. So within 2 months, I was pregnant. The second month, I was pregnant. But then later, I came to know that it was an ectopic. It was on the right side. So thankfully, there was no rupture, and I was given methotrexate. So now it's been almost 1.5 months after that. So we need to have a gap of 3 months before trying again, but we are thinking to have 6 months of gap just for that to heal. So my question was, will my tube go back to normal as it was, or has it done some damage to the tube already? And do I need to take a HCG test to check if the other tube is intact? So yeah, these were my questions.
All right. Thank you for that, Rensha. Yes, you do need an HSG test before you retry. Ectopic pregnancies can damage the existing tube. However, it is not for sure that they damage it. That's number one. Number two, and probably more important for you, is that, see, when we look at these diagrams, it looks like there's a large area in which all this is sitting, that the tubes are, clearly like that, and there is a uterus. Actually, it's all within the area of your pelvis, right? So it's a very small area and everything is tightly packed. Generally, if there is an ectopic pregnancy that happens, it is often because the hair inside that side of the tube at least has been damaged, the cilia. Now, it is possible that the second tube may also have damaged cilia, right? And unfortunately, that cannot be seen on an HSG test. But certainly, at least to make sure the tube is open, you must do an HSG test before you try a second time. That would be the correct way to go about it. And yes, using diet, lifestyle, yogic exercises like Sharda suggested, these can be ways in which we can improve the function of the existing hair and the existing secretory cells, so that there is a lesser chance maybe of ectopic. There is no guarantee, but certainly we can do these things to improve our chances.
Yeah, okay. Thank you.
You're welcome.
Mahesh, this question. This lady says, I have undergone a hysterolaparoscopic surgery. The report says bilateral tubes, slow spill seen. Is it possible to get pregnant naturally?
Yeah. So yes, it could be possible for you to get pregnant naturally, but remember, this slow spill is what I mentioned when I showed. Let me, in fact, sort of go to that slide, because we had different levels at which this could happen, right? So let me quickly go to that slide. Sorry about this rapid scrolling and making you dizzy. Okay. So this falls within this partial blocks. This partial blocks means if both sides have partial blocks, then the fluid will flow out, but it will flow out slowly. So both of those sides have some blocks. So it's not coming out as freely as a fully open tube it would happen. Therefore, it is possible that you could fall pregnant. However, if you don't, after about 6 months of trying and all other factors have been optimized, you must consider it the same as a bilateral blockage and see what options you may have to try and open them up. Again, things like a castor oil pack, using natural foods, improving your diet, working on yoga, etc. These are things, if those blockages are not hard blockages, but mucus plugs, several of those could open up. And especially in your case, Ayurvedic Uttarabasti could be a good option for you to consider.
Mahesh, just clarify the meaning of restricted spillage from both fimbriae.
In this particular case?
Yeah, there's a question.
Okay, so restricted spillage means you put in a certain amount of the liquid. Now the liquid passes through that entire tube. Fimbriae means the little finger-like projections at the end of the two tubes. When the fluid passes freely, the whole volume is expected to come out fully. When it's coming out restricted, it means that there are some blockages due to which the full volume did not come out.
Yeah. Okay. Is there any other question that we can help answer for anyone? Okay, so what I'm going to do is we will send each of you, we have your email ID. Oh, all right, sorry, there's still a question. Dharini's query. I had undergone a cannulation in the left tube during HSG for free spill. It's been more than 6 months. Is there any chance of a blockage again? And can anything be done naturally to prevent the blockage?
Yeah. So,
Sorry, I just want to interrupt. This is for you because I speak to a lot of women and many of them will tell us that we have done our HSG test a year ago and it was clear. We are not able to conceive and the doctors are recommending an IVF. Why should an IVF be done if the tube test was clear?
Okay. All right. So we'll answer both of those. I'll start with Dharini's question. So Dharini, unfortunately, the medical literature clearly says that in close to 90% of the cases, when recanalization is done to open up a fallopian tube, it closes down within 6 months. So 9 out of 10 women who go through recanalization surgery, the tube only stays open for 6 months. Okay, that's number one. However, if you seem to have done it only on the left side, etc. Maybe the right side tube is still open. If that is the case, you should still be able to, all other things being fine, right? So again, the thing is, today we are just discussing tubes, but there's egg quality, there's sperm quality, there's the quality of the uterus, the endometrial tissue, so many factors in fertility. If you optimize all the others, and even if one side closes up, if the other side is fully open and functional, you should be able to conceive. That's on your question. Okay. Now, Sharda, to your question, which is at Sepalika, for example, on the program, we have never accepted fallopian tube test or HSG test, which is older than 6 months. The reason for this is no doubt like we said, why should you subject anybody to anything if it's not needed? But we have seen that there is a possibility of the closing up of the tubes, especially as the lady gets older, in women who have a lot of PMS symptoms or who have a known history of endometriosis, or they have fibroids growing in the uterus. All these conditions mean that the fallopian tubes can get damaged within a 6-month period. So it is a very delicate structure, and we don't accept patent tube reports which are older than 6 months for this reason. So it's not good enough to say that, last year I did my test and it was open. And if you haven't conceived all this while, it is possible it could have gotten blocked in the meantime.
Okay, thanks. I just also want to let everybody know that we have done a lot. Every month we do these kind of knowledge series webinars, and we've covered different topics from sperm health to egg quality to diet for fertility, like this one on fallopian tubes, and they're all up on our website. We will also share the link with you. You're most welcome to take a look at some of those older webinars because they're as relevant, and they are our perspective is very, very different. We're able to give you a multiple perspective, not just the allopathic, but also, as Mahesh said, evidence-based work that we have seen, read, and our own experience over the last 3 years working with couples on fertility.
All right. Okay. So final call for any questions that you have. Otherwise, we can bring the session to a close. So anybody who wants to put their hand up or type anything in the chat, you're most welcome. All right. Okay. So I don't think there are any further questions. So like Sharda said, the knowledge webinars are all available. And again, a lot of information which is there is unique. So please do take a look at those. Some of those can just help you. You're all here because you want to do something for yourself rather than just depend upon your provider. So please go ahead and do it. And, look at the webinars. Thank you very much for joining. Wish you all a wonderful festive season, which we are coming into in India. All the very best to all of you in your fertility journey. Take care.